All right, welcome everyone to the Empowering Lactation Providers Supporting Breastfeeding Through Emergencies webinar. My name is Kara Kaikini and I use she, her pronouns, and I'm the Executive Director of the Maine State Breastfeeding Coalition. Before we get started with the webinar, I wanted to make a few announcements. First, for future reference, you can find our recorded meetings on our YouTube channel. So if you are already ready to, with your camera to scan QR codes, we'll have a couple of those in these first slides. Otherwise, we'll definitely send you links in the chat box as well. Okay. Also, we aren't able to offer CEUs at this time, but we can send a certificate of attendance if that is helpful. So after the webinar, we'll send you an evaluation to fill out. And if you would like that certificate of attendance, please be sure to add your email to that question so that we know to email you one of those. Okay, and our next educational webinar is on June 6th, and it'll be all about pelvic health and postpartum recovery tools for birthing parents, taught by Jen Gelfand of Root to Rise Physical Therapy. You can find the objectives. She has about 6 objectives listed for this webinar. You can find those on our website. And I'm very much looking forward to that webinar. And a reminder that our webinars so far have been offered for free. We are a small nonprofit who operates on the generosity of donors and sponsors. So we want to thank our annual patron partners for their support: Acceleron, Soft Corner Midwifery, 207 Pediatric Dentistry, Brandy Rogers, Maine Health, Barbara Bush Children's Hospital, Let's Go, and Martins Point Healthcare. And we so appreciate donations. So please consider making one to allow us to continue to do all of the work that we are doing. And remembering that every drop counts. So please consider making a donation here today, either using that QR code for PayPal, or you can Venmo at Maine Breastfeeds. And today, if you make a donation of $10 or more by the end of the day, you'll be entered into a drawing for a $25 Amazon gift card for a little incentive. Please consider doing that. And so far, we only have 27 people here at this point, so you might have a pretty good chance of winning if you make that donation. So thank you so much for considering. And we can always use more people with a few hours a month to support our committee work. So you can also let us know through that volunteer link that we will send you as well. All right, so again, welcome to our webinar, Empowering Lactation Providers Supporting Breastfeeding Through Emergencies, and welcome to our speakers. Jennifer Russell is a seasoned registered nurse with a career spanning over 25 years, encompassing pediatrics, lactation, public health, and emergency preparedness. She holds a BSN from Union University and an MSN from the University of Phoenix. She has served in numerous leadership and committee roles, including 2-time past president of the Memphis Area Lactation Consultant Association. She now represents the Tennessee Breastfeeding Coalition on the Infant and Young Child Feeding and Emergencies Constellation with the United States Breastfeeding Committee. Currently pursuing a Ph.D. in nursing science at the University of Tennessee Health Science Center, she passionately researches the impact of natural disasters on breastfeeding dyads. Her dedication to improving maternal-child health, increasing access to lactation support, and enhancing the capacity for disaster health response propels her to bridge the gap between nursing, lactation, and emergency management. And then we have Bill Gwyndon, who serves as the Mass Care Coordinator for the Maine Emergency Management Agency, a position held since May 2022. He previously served with the American Red Cross Northern New England region as Disaster State Relations Liaison and Mass Care Coordinator since February 2020. As Mass Care Coordinator, Bill serves as the Maine State lead during a natural or human-caused disaster or public health emergency and mass care duties, which include sheltering, emergency feeding, distribution of emergency supplies, and family reunification. Bill has served in a variety of public and private sector leadership positions in Oregon, Colorado, and Maine, which included a 40-year career in the fire service. During his career, he has responded to several incidents in a variety of roles, which has included the Columbine High School shooting, fires, and other situations. Bill has a Bachelor of Science degree in Organizational Management from Colorado Christian University and a master's degree in Public Administration from Anna Maria College. So welcome to both of our speakers today. And Bill, I'll let you go ahead and share your screen. And we can go from there.
All right. Good afternoon, or yeah, good afternoon, everyone. Got to make sure what time it is, and please bear with me as we get this going here. We had it working really well earlier, and we'll see if we can do it again. So everybody see it?
Yes.
All right, that's a good sign. Well, I do thank you for the opportunity to share a little bit. And I will tell you, my experience is not with breastfeeding, but I do have a significant passion for making sure that when we're looking at disasters, we take an all hazards, all risk approach, but not just, looking at, where people would shelter, but also what are the needs in those situations. So, for example, even nationally now, breastfeeding has become a pretty hot topic, and I say in a positive way. It's something that we look at vulnerable populations with those with needs that we never think of, and we also think about ways how do we make individuals comfortable when they've been displaced due to a disaster. So I was really thankful for the opportunity here to be able to share. And, at the end here, if you have any questions, please feel to reach out, or you can even email me as well. A couple things I want to let people know when we're looking at disaster emergency shelters or even cooling and warming centers. The decision is to open those facilities is at a local level. Often it's a municipal, local emergency management officials will make that decision. And the aspect that, one thing when we're looking at sheltering or even cooling, no one size fits all. One of the things that's really important, we look at the community demographics. So if you have families with small children, that would be in consideration as far as what resources may be needed at that disaster emergency shelter. And again, in the context disaster emergency shelter, we're not talking like homeless shelters or wellness shelters, but things that would occur and because maybe there's been a wildland fire, a flood, or in Maine, an extended power outage, which we seem to have common. One thing that we've started to see even a national trend, and I'm glad Jenny's on here today, is the needs of nursing mothers and pet owners have become really important considerations that were kind of put aside in the past. A lot of times when we're looking at sheltering, we're thinking about putting people in facilities just to get them out of harm's way, but there are needs that need to be met. Nursing mothers is one, and pet owners. Pets are part of family. So it's been kind of interesting looking at the trends nationally, which I try to monitor regularly. So I'll give you an example right now. There's about a little over 2,000 individuals nationally in sheltering situations right now. About 23 of those are within non-congregate sheltering situations where, like out in Maui and parts of Florida, that are doing long-term transitional housing. And they call that non-congregate sheltering. And again, in Maine, that's not real common, but it could occur. It did occur during COVID. The traditional congregate sheltering model right now, you probably have anywhere from 40 to 50 individuals in about 6 locations in the mainland of U.S. That are being housed because of weather events right now, typically are multifamily fires. So again, when you're looking at your own communities, the needs of nursing mothers is really a critical factor. And again, breastfeeding is a safe infant feeding operation during disasters. And I think it's important to think about that. We often talk about preparedness, and we talk about, the idea, well, we need to have food and water for 72 hours. And we use the term emergency management, all disasters start local and end local. With the audience here, really well the benefits to breastfeeding in a disaster. And I think the one thing that I'm finding is the emotional benefit. The idea when somebody's been displaced due to disaster or some type of no notice event, whether it's an active shooter or maybe a flood or some other situation or hazardous materials incident, people are stressed. Stress is, unfortunate part of that. But at the same time, if you can find ways to cope and make your experience more pleasant, it could really make a difference in the recovery. There's been research that said infants are more vulnerable during emergencies due to their highly emotional susceptibility to infection and the ability to care for themselves and their specific food and fluid needs. And we also know when you're going in a sheltering situation, you're congregating with large groups of people you may not know or do know, but you also could be very easily vulnerable to any type of, we found with COVID, we had to make a lot of changes in how we shelter. No longer could we put 40 square feet per person. We had to go 110 square feet. And, we had to put in and still do incorporate a lot of the good best practices like sanitation, with sanitizers and masks and stuff like that. But oftentimes, we don't have a time to prepare for that facility. So in a natural disaster, they often create an unsanitary environment where clean water, food, and others may be in short supply. We, as you well know, breast milk provides antibodies which help protect babies from illness. So it really is important to be able to continue that even in a disaster. And we also had research has found that breastfed babies have lower risk of diarrhea and respiratory infections. And it's not uncommon to hear families with small children in a disaster situation be a little more immune to different diseases, colds, flu, things like that, because you're around an environment that's not necessarily controlled or is limited in what it can control. And as with research, it also finds that breastfeeding protects infants from unsafe water, which can increase the risk of disease. And the thing is, with stress, because of the disaster, not only for the mother and the family members and other children, it's important to have anything you can do to prevent and reduce the impact of that disaster can make a big difference in recovery. The benefits of breastfeeding disaster is it can reduce stress. And that's really what I think is really an important consideration. Often those that open shelters, we're training them more and more to consider the impacts of those in the community. What are the vulnerable, whether it's families with small children, the elderly, those with medical issues. But anything you can do, to reduce that stress can make a big difference. As you know that, if you can you reduce your stress by, the hormone that helps you relax and allows breast milk to flow. It can also, calm your baby by breastfeeding and skin-to-skin contact, just like anybody that's been impacted by disaster. Sometimes the idea of even a hug, we often say give your shoulder, not your mouth, and sometimes a hug can help people get through some difficult times, and that goes with children and babies as well. And the other thing is that there are some ways you can overcome there. It's not saying that it will happen, but in a disaster, you may not have your children with you. So you're working or your child's in childcare. There are some things you can do if you're separated from your child. Hand expression is a good way to express mouths. And in some cases, one of our big challenges is we may not have the power supply if you don't have a battery backup for your breast pumps. You may, the hand expression might be the best way to overcome it. And again, I want to say one thing that's important: those that are that breastfeed, you can be a great resource to those in the community who open shelters. You can provide education and help them understand the needs of nursing mothers and families. It can make a big difference on the overall well-being of those in the shelter. But what can you do to prepare? Educate those in your committee about becoming familiar with the needs of nursing mothers. And again, it's important. We have an increasing number of weather-related disasters and disasters in general. Not too recently, FEMA reported that they were averaging 3 new disasters a day, and that's pretty scary when you're looking at the number of, whether it's weather related or even situations of multifamily apartment fires, single family apartment fires. And 99.9% of the time, people have no idea what they're going to be facing. They don't know they're going to be displaced. So it's important to think about taking care of yourself. And your family's preparing emergency food and water supplies. You know, if you have small children that aren't being breastfed, think about their needs. What can you do to prepare? Oftentimes, you know, when you're in a shelter situation, it does take time to get food. We recommend 3 meals a day, hopefully 2 warm meals a day if at all possible in a shelter, but it's not something that may happen right away. It may take some time. So anything you can do, even preparing emergency food and waters, and snacks. And again, think about the needs of your family and what, for example, snacks like crackers, fruits, things like that are really helpful. And the other thing to think about is preparation, that if you have an alternative breast pump, whether it's a manual or a battery operated, remember that not all disaster emergency shelters will have a generator power. Most do. We're seeing quite a few initiatives to increase resiliency in communities. Many or even your nonprofit organizations are able to access generators for power. And again, knowing in Maine, recently we had a 320,000 out of power for quite a few days. And then in our December storm of this last year, we had 420,000. Now we're fortunate power was restored pretty aggressively, but that's not always the case. There's always, pockets of the state because of our rural nature that don't have those opportunities to get power restored timely. So again, that's part of that prepare. Think about those things you can do. Even if you have a battery operated breast pump, maybe the idea of even extra batteries on hand would be helpful. I do know that even for our cooling and warming centers, many of them, one of the things that they're trying to incorporate is charging stations. So that might be something to consider, identify those community locations that would have those resources. So, the thing that I guess my message is that it's important to consider, one, take care of yourself, but think about those situations where you may not have at your disposal. Even a simple thing, if you do have to store your breast milk, think about some ways to maintain its temperature, whether it's putting it in an ice chest or some type of cooling bag or some sort. It's really important to think about. And again, keep in mind that most that open disaster emergency aren't familiar with the needs of those emerging mothers, and you can be a good resource to educate them on that. So again, I know my session's brief. I'm really looking forward to Jenny, but if there's any questions, I'd be able to try to answer.
Thank you so much, Bill. That was really, really great. And I really appreciate the reminder that for those of us who are on this in this webinar today, most of us work in a professional setting and throughout the state as well. So to connect up with local emergency shelters, I think is a great idea and offer that education. And I know Jenny will share some educational resources for us to bring, or at least to make that connection and say, if you have nursing mothers in your shelter at any time, this is who you could reach out to. Great. Thank you so much. And I think if anyone has any other questions, actually, I do see a question in the chat. Do shelter operating agencies in Maine pre-stage breastfeeding support elements in their shelters?
No, what we typically do is we're right in a process of educating the shelter operators, and usually they're local municipalities or local emergency management agencies and few nonprofits. We're kind of getting a big focuses on vulnerable population, which would be children, small families, and trying to educate what the needs are. So it's a slow process. We also try to educate on possible medical needs, and also even simple things as the idea of that maybe you have individuals that may have special needs, maybe mental health or medical health. So that's really kind of all tied into that. Just the awareness is what I'm finding, and even nationally, I think it's becoming more of a issue between that and pets. And at one time in Life of the Red Cross, they wouldn't allow pets in shelters with the exception of service animals. That's becoming more of an accepted thing. So there are some things that can be done. One of the things we do encourage is, with shelters, to even consider privacy areas. So if individuals needed a place to go, whether they had allergies or even maybe they needed to breastfeed and wanted some privacy to accommodate that. A lot of it is starting with looking at the primary and secondary locations in the community and identifying what the community needs are. So one part of the state may have an elderly population, other may a mixed, whether it's, and even goes as far as type of foods, it's not a peanut butter and jelly situation. And what are the special dietary needs of all individuals that come into, for example, in some of our communities, we have some very diverse ethnic foods that are needed. And it's that same context. And with nursing mothers, it's not that you can just get a can of formula. There's some big differences I know from my own children and the benefits of breastfeeding. But I think the idea, the awareness is something we're trying to approach more and more. And the idea is don't forget about those that are forgotten. That's really important to consider.
Excellent. Thank you so much. And if you have more questions, feel free to drop them in the chat box. We'll make sure that Bill can answer those at the end of the session. But for now, we'll move on to Jenny's presentation. Oh, you're on mute, Jenny.
Thank you so much. I'm going to pull up my screen right now. And let's make sure that you can see. All right. Do you see that? All right, great. All right. Thank you so much for inviting me, and thank you so much for coming. Moms really struggle a lot during disasters with breastfeeding, and I would like to be able to show you as lactation providers just some ways to get started in caring for those moms and in taking that into your communities. So the objectives, as we've said, is just describing the vital role of breastfeeding, which Bill did an amazing job at. We're going to look at the lactation provider's role and some resources that you can use. So let's begin with some disaster statistics. And in the U.S., in 2020, there were 42 recorded environmental disasters, resulting in a loss exceeding $1 billion. And Bill talked about how many disasters are occurring, and they're occurring more. NOAA estimates that the cost from 1980 to 2021 was about $2.1 trillion and over $742 billion. And so it's going to be really important for us to prepare as much as possible, especially since we're going to need these dollars to spread, as thin as possible. Kids make up a significant portion of disasters. The Save Children Federation said that every year 175 million kids globally are expected to be affected by disasters. And, when we go to think about breastfeeding, a lot of times moms don't want to reach out. And then there's a poorly organized disaster response. And a lot of times the disaster responders don't really know what to do with a breastfeeding mom. And so moms, DeYoung et al. Found that moms, when she did a study, were more likely to wean early from breastfeeding during the Fort McMurray wildfires that was in Canada. And I think that's a really significant percentage, going from 64% to 36%. And so, some problems for the families, families with infants and kids, they're often overlooked. And a lot of times, like I said, emergency personnel, they're just unaware of the additional resources because that's not their daily, activities. And to support babies successfully. One of the big things that is a problem is a violation of the WHO code. And I know most of the lactation providers know what that is, but the WHO code is the International Code of the Marketing of Breast Milk Substitutes. And what that is, it's all about the marketing of commercial infant formula is part of that. And so in disasters, we often have an uncoordinated and unsolicited distribution of breast milk substitutes. That's what the research says. And so basically what's happening is they're bringing formula in, and then they're just handing it out because they're like, oh, here's a baby, here's a baby. And as we know, as lactation providers, the Baby Friendly Initiative, through the Baby Friendly Initiative, we know that handing out formula samples, even in the that initial postpartum period, does affect breastfeeding negatively. And so one thing we can do is help those families have a preparedness plan to get ready. And moms and dads and families are very accustomed to already having a go bag. That's the diaper bag. And so just to have a different type of go bag, I say, is going to be helpful, that they can grab and know that they have that thing, what they need in there. And healthcare providers, we need to be proactive and provide that anticipatory guidance and help the parents know what to do, because when you know what to do, it's not as stressful to be able to get through it. And communication barriers are huge, because moms may go up to the shelter manager and ask for something, breast pads or whatever, and they just don't know, because that's not their background. That may or may not be their background. But what's really interesting is that a lot of the emergency plans do not routinely address breastfeeding. And like Bill said, nursing moms and pets are, becoming more in the forefront. So I'm really excited about that. And when I say emergency plans don't address breastfeeding, I mean, I've gone through a lot of FEMA documents and a lot of other state documents, and it is just not even mentioned. And so, however, formula is mentioned, in those kind of things. And so I think it's just something that, has, not been, if you don't know, you don't know. And that's where we come in as lactation providers to be able to share that. And because, during disasters, the great thing is, what you can tell those, responders, what you can tell the emergency managers, is that breastfeeding gives immediate nutrition. A lot of times it takes a long time to get formula in. And as we know, within 2 to 3 hours, that baby is going to start becoming hypoglycemic, if they're really young. Breast milk is generally safe. And one of the things that moms are most concerned about is the environmental exposures to that. And the CDC during Hurricane Katrina and during other hurricanes came out and said that it was fine to breastfeed, during those exposures. And so they will, look at the exposure, individually when that happens. But they found that moms were very concerned about giving that. The problem is when you're mixing formula, then you have contaminated water. And so, as we know, mom can pass on those antibodies. And it's going to reduce that risk of illness. It's going to keep them, especially of diarrhea and respiratory illness. Those are some of the most common morbidity and mortality issues as far as illness. Breastfeeding is cost effective because it is free. We may need a little equipment, but overall the milk, if the milk comes straight from mom and we're doing well, then it's free. Mom takes it with her. But we want to make sure that they have, some security in that. If mom is in a safe space, then that helps the emotional security. Breastfeeding, especially if you can put them in like baby wearing, that can really help mom to be able to have her hands free. Of course, it supports child spacing many times in disasters because they don't have access to medications. Moms often have some unintended pregnancies. And so breastfeeding, of course, can help that as well. And as we know, the AAP and CDC recommends exclusive breastfeeding for the first 6 months with the complementary foods after 6 months until 2 years and beyond. And we know that 83% of infants start breastfeeding, and then even 35% continue to a year. So I'm going to take you in this journey. FEMA estimates that 10% of all people in evacuation shelter are infant and toddler age. And so you can see if you have 10% of people that are in a shelter that are infant and toddler age, and we have 83% of all infants have ever breastfed, then the likelihood of having a breastfeeding dyad, breastfeeding mom or baby is very high. FEMA has what they call a commonly used sheltering items catalog. It's just a catalog of supplies, and it goes everything from, food, chips and cookies, to more urgent supplies like diabetic equipment, and it does include. They recently updated that with the formulas to include soy formula and some different formulas, but they did not still include breastfeeding. And so we're trying to make a big awareness about this. And because the FEMA breastfeeding support, they do have some, but you have to get it through the critical needs assistance program. And I'm going to help you go through that later. But I'm super excited. The recent FEMA Achieving Equitable Recovery Post-Disaster Guide, it includes breastfeeding resources. And so that, I think, is a huge start towards getting there. And so remember that a lot of the emergency managers are going to be, have older plans, and it's going to take a minute for them to get, into those new guides into their plans. So what is your role? That pre-disaster education, you want to educate both your moms and your families, and also the other healthcare providers of what to do, and what the breastfeeding moms may need should there be a disaster. And they just make a plan with that. And so we want to train those healthcare providers, because if you can almost take on a train the trainer role, and make that spread through the moms. You can offer direct support during disasters, as a lactation provider. That's going to be really important. So whether you are, whether you are an IBCLC, clinical lactation, or, a CLC, CLS, et cetera, or, a peer counselor, or, an advocate and peer, that is so important. Every single one is so important to be able to call on during disasters. And we need to be able to distribute those resources. Like I said, we want that coordinated distribution of the resources so that the moms get the right equipment, because we don't want a formula feeding family to get breastfeeding stuff, and then the breastfeeding family to get formula feeding stuff. And so we're going to have to distribute those. And be an advocate through this. And one thing you can do is you want to monitor your own breastfeeding rates in your jurisdiction. So you can be able to express how many babies would be affected with that. Lactation providers, you can also, have psychosocial support. One issue that I found in the literature was a mom may wait in a FEMA line. She may go to a FEMA line and get gas or other equipment that she may need. And then after that, she thought it was going to take 2 hours, but it really took 10 hours. And so she was engorged. And so if there's any way that we can communicate and be able to lessen that load, so that the moms aren't in line for 10 hours, it would be so helpful. In that, just that public health communication. And we want to teach hand expression. That's going to be so important. A lot of moms don't learn hand expression in the hospitals. And so that, I think in general, it's great to know hand expression, but that is the free way. You don't have to have any equipment to be able to hand express, except for the thing you're putting it in. And I put it all on one slide because we know that breastfeeding dyads have lots and lots of needs. And so most of these needs are things that we already take care of, already do. And so I really want to just really emphasize that we need to keep a lot of the resources that moms and babies and families already have. And when we, because moms still may need their WIC resources and, you know, the other resources. You want to be able, you can help to represent to those moms and families. We want to identify that lactation status early. For example, like when, you know, in my experiences, when I was a disaster health nurse in a shelter, we would find a lactation status when we did, like, it's called a CMIST, but we would find a lactation status when the disaster health nurses did their assessment, which could be 1 to even 24, 48 hours later to know. And so if there's a way that we can identify that a parent's breastfeeding early, that would be so helpful to them and get that milk to them quickly. And so we want to train our humanitarian workers on that. We want to train our lactation personnel. Say you want to train the disaster people about breastfeeding and breastfeeding people about disasters. And we want written educational materials because that's going to be so easy to pass out some sheets of paper. You know, you can also, you know, have the parents go to the website. One website that has multiple languages, Lactation League. They have, look at their infant and young child feeding and emergencies page. There's some, you want to make sure that the basic needs are taken care of. And we know clean water, nutritious food, electricity. But one thing that I saw in the literature, and if you think about it, ice, especially in, you know, especially in summer months, you know, to be able to, you know, keep that breast milk cool and also to keep mom cool. We want to make sure they have access to their health care. Then that clinical lactation support, you know, lactation counseling, peer support, we want to have those on, you know, all of the levels and make sure that we know who to call. And we want to make sure that we use gender and culturally sensitive care for these families. We want to keep them together. And then when you go into like some supplies you're going to need your milk collectors, you know, your breast pumps, collection bags, you know, materials. And then you want also to have things to sanitize and sterilize the infant feeding equipment and those pump parts if we're using those pumps. Moms need soap and water to wash their hands. And we want to designate a refrigerator for milk. So think about the things and the processes that we are already doing in the hospitals, for example, the NICUs. I think that those may be able to translate to shelters if we can bring those processes in. You know, nipple shields, SNSs, and that would just be available for the lactation providers to help the parents with. And, you know, a nursing pillow, baby wearing is going to be, that's something that I think would be very helpful in our emergency kits if we have baby wearing gear, because that gives mom, you know, baby right beside mom. They're going to have skin to skin, and then mom's going to be, our mom or dad or families are going to be able to do other things and have have fans free. Of course, we want diapering and pack and play, family support. They need to have a safe and quiet and very private space. And we want safe sleeping for the entire family, and safely sleeping also means, you know, safety, you know, away from crime. And give that supportive environment. And like I said, we want to cut the red tape, you know, and we don't want families to have to be separated from their babies for extended periods of time. And so if there's ways in your community you can come up with processes to help cut that, it would be very helpful. Because it's those minor inconveniences, especially like something closing that you thought was not going to close, that just perpetuates more stress. And so, you know, you can help with getting their meds, you know, if they can't, and just that coordination of care as lactation providers, we already know that kind of thing. And when they need transportation, we need to make sure that they have their car seat that they may need. And so that's and so I want to go through this real quick. FEMA is has a, you know, for the process, this is going to be the process for assistance for breastfeeding support from FEMA. And so you have, for example, the disaster event, you call 911, the first responders come in, the local agencies come in. You're going to, they activate what's called the Emergency Operations Center, and that's where the emergency managers all come together, from electricity, fire, public health, like Red Cross, and all the people come together. They're going to activate these emergency support functions, and emergency support functions are just the categories of what, like electricity, like I said, and public health, Red Cross have. For example, ESF 6 is Red Cross, ESF 8 is public health. And so that at that point, you know, when they do that, the county, if the county can take care, you know, of that emergency, then they do that. But let's say the county needs additional help, then they would ask the state, and the governor would decide a disaster declaration. At that point, the state resources, they do their initial damage assessments, and then they ask other states to come in through this EMAC, Emergency Management Assistance Compact. They ask other states to come in to for help. Then the state appeals to the federal government. So it goes up from here. And then the president will make the decision or not to, you know, make a federal disaster declaration. What that does is it opens funds for public assistance, and that public assistance fund, those are things that are going to, you know, take care of the roads and bridges and community things. This is not for the for individuals. And so, you know, yeah, and so utilities, parks and recreation, that's what that is for. But then they can, if needed, and they see that the disaster, you know, has a bigger need where the people need individual support, then the president can open that. And what that is, one of the things in it is the individuals and household programs, and that's just it's got a lot of crisis counseling, legal services, supplemental nutrition, so your SNAP benefits, and that is very helpful as a lactation provider to know if they opened that individual assistance, you know, for the individuals and households, because the families can get some reimbursement, especially for critical needs, and they see breast pumps in as a critical need, so that's amazing. And so, but the problem is you have to have a provider order, a doctor's order, and as you know, the providers may be closed, their offices may be closed, and you may not be able to get to that, and know that that is only a reimbursement program. And so this is just real quick. The individuals and households program, it is, you can see in, for example, 2023, it was only, you know, opened up in 20 disasters, whereas, you know, public assistance was in 108, and there was 108 total disaster declaration. So this is just to show you that it doesn't happen every single time. And that just helps you to be able to manage that and guide that. And I'll tell you, in talking to lots of emergency managers and lots of lactation providers, over time, you know that the maternal child health providers have also often said, "Oh, I haven't thought about that my patients may experience a disaster." In the early emergency management phase, "Oh, my client may breastfeed," and so you can see there's like two sides to every coin. And you know, and one of the things that is, you know, troubling often is that, is this a mass care? Is that a feeding problem? You know, is the breast milk feeding, or is it health? You know, and so yeah, a lot of times it's, where do you put it? And so my recommendation is to put it in both, and put it in all of the emergency support functions that can help with that. And parents are just, like, you know, expected to do their own thing, and we don't, and so we need to support them. We want to provide that support, and we want to get breastfeeding supplies beforehand, because the local stores may be closed, or there may be a huge run on it, and there may be out of the supplies. And one thing that I actually presented to the International Association of Emergency Managers, Children in Disasters Caucus. And it was an eye-opening experience. And I met Mike Prasad. He's actually on here today. And we quickly put out an article about challenges with pediatric mass feeding in the Domestic Preparedness Journal. So I would love for you to look at that. It can give you some very practical knowledge in tangible ways for you to talk to emergency managers in the language that they understand. And so here's some resources for you. And I put these in the order of kind of how they have come out. And so you have the IFE core group, the Emergency Nutrition Network, which is with the WHO, World Health Organization, and they have the Infant and Young Child Feeding in Emergencies, and that's an international guidance. Lactation League International has a great website, like I said, with lots of information. The American Academy of Pediatrics has just a pamphlet I'm going to show you in a second. And there's a HHS maternal-child health emergency planning toolkit, infant young child feeding emergency. So HHS, CDC has one. And also, for if you go to the emergency managers and they're like, oh my goodness, I don't know where to go to this. There is a infant and toddler feeding exercise that was developed by Mike Prasad that can help them get started with that. And so here's the AAP sheet on infant feeding and disasters and emergencies. It goes through the things that we talked about today. And one of the things I just want to mention is that, look into donor milk and the milk banks as a resource for getting, for having the food, and having the feedings for the baby. What we want to do, so, we have over here the moms not breastfeeding. If the lactation is not possible, we'll look into donor human milk. And then at the last resort, we're going to provide ready to feed standard formula. So very similar, if you think about it, to all of the process in the NICU. And so final insights, just real quick, we, like I said, we want to make a plan, look at your resources, be an advocate, educate, around, provide that lactation support and mental health support, collaborate in your community. And I do want you to consider signing up and getting trained to volunteer if a disaster strikes in your community. And so you can sign up and get the training and then, do it at your convenience. And so do you have any questions? And also, I do want to tell you that I have references here if you would like to see, and I'll leave these up while we talk about questions.
Excellent. Thank you so much, Jenny. That was really, really great. And yeah, if you have questions, feel free to either unmute yourself or type in the chat box. I added something in the chat box asking if anyone has experience being in shelters, either personally in an emergency or as a professional, and what that experience is like. How did that go? Supporting what was it like for the families in those shelters? Love to hear more of those experiences. And Bill and Jenny, you might have your own experiences to share as well, and that would be great to hear. But I also, I loved the list of all of the needs that a breast and chest feeding dyad would have. So I really appreciated that. I was surprised to hear that none of those are included in the
Right.
commonly used items. And I'm guessing you've given feedback to them about that. And
Yes.
How has that conversation gone? Like, do you see that happening? Do you see that edit being made in the near future?
I have seen the edit. When I first saw the edit in August of 2023, and so I've been on this journey since 2017. So August of 2023 is the very first time that I saw FEMA have you know, talk about breastfeeding. And it was just a little blip on the website, and I was like, we're getting there. And so I was very excited to see that it was included in the functional access needs. I really hope when they revise the CUSI, they call it the commonly used sheltering items, I really hope when they revise that, it'll include that. And, you know that that's just recommendations. And so I encourage emergency managers and lactation providers to get together and you know, decide what's best for your community, decide what you the capacity that you're able to do, and you know, where you can reach out to other counties to be able to get assistance if you need it.
Great, thank you. I see Michael has his hand raised, so go ahead, Michael.
Thanks. I just wanted to echo a little bit more of what Jenny had in a couple of areas. That difference between public assistance and individual assistance, one of the key factors is time. Individual assistance doesn't happen until days, weeks later, months, and in the case of superstorms and you know, major wildfires, even years later. We've got some folks on the caller from New Orleans. There is still public assistance from Hurricane Katrina being put in place. Now it's mostly infrastructure, bridges, roads, et cetera. But that's kind of the idea, that it takes a long time. And individual assistance is also dependent upon the governor asking for it. In both of these cases, when you get to that chart that Jenny pointed out, the state government or tribal or territory, they're on the hook for 25% of the costs. So they may not be necessarily you know, excited about paying out money for stuff. But one of the key elements of that public assistance aspect is that emergency protective measures. Jenny and I are really trying to get the idea of breastfeeding support included in there, the same as you would feeding support, right? So if a shelter needs to replace a Cambro or a spoon or whatever else that they have for feeding supplies, that should be no different than it is for a breast pump or lactation services, anything like that. That's the kind of point. And then finally, just a note that we are approaching this from a number of different angles to try to get the changes made at the federal level. We recognize that if that, as Jenny mentioned, that CUSI list, the states look to that for a guidance as to whether they're going to get reimbursed when they buy stuff. So if it's not on that list, they have a pretty good idea that they're not going to get reimbursed from the feds on declared disasters. So it's kind of it is a guidance, but it is sort of the doctrine. If it's not here, you're not going to get reimbursed, kind of a thing. So if getting these items added in there certainly will help. One way to do that is through an exercise, and Jenny and I are going to be involved in the National Mass Care Exercise, which is coming up next month, or this month already. Is it May? We are already in May. This month in Shippensburg, Pennsylvania, and a number of states are participating in that. And our goal is to, we have an inject for this item in the exercise. So they'll see breastfeeding issues come up in the sheltering exercise, which is what that is. And we'll see an opportunity for how the Pennsylvania is going to react to it. And then other states will do the same. And then we're going to provide some guidance in the after action report. That's going to go to FEMA. And it'll be another way of sort of saying, without having any babies injured, here's what could happen. You know, that's kind of what we want to do. Thanks for the time.
Yeah, thank you so much. And thank you both for your advocacy on all of this, and it's inspirational, and it's definitely continue to share ways that we can help with that kind of advocacy at the state or federal level.
I would like to reiterate that, you know, or just, you know, really, you know, bring what you said, you know, up. It is so important, and know that whatever it is, if you keep on, you know, it may take a while. Like I said, I've been on this road since 2017, but, you know, it may take a while, but just continuing to have those conversations. But when you're at conferences, you know, I saw FEMA right at the conference, and I'm like, did you know that you don't have this? And they're like, oh, I hadn't thought about that. And so a lot of times it's just things that we haven't thought about, and or they haven't thought about, and just bringing that to light helps. And just to include those, we want to make sure that we're inclusive, in that the families are able to feed their baby the way they want to feed their baby and not be forced into something else.
Yeah, I really appreciated how you explained the different perspectives. You know, families and providers might be thinking more about just feeding the babies, but not so much about emergencies. And the emergency prepared folks are focused more on emergencies and not so much about feeding. So working together in that collaboration and cross education is so important. And I see a question from Victoria. Where do you find training programs? I think that could be for both Jenny and Bill. Victoria, I'm not sure what state you're in. And is there a specific maternal child emergency response training? Are there any links that could be dropped in the chat or anything else that you could share?
I think
Michael?
there are quite a few resources. I think it's state specific what's available, particularly with children. There's some preparedness models out there, whether it's Red Cross and other organizations that provide it. And again, it kind of ties in, the idea, and I appreciate what Michael and Jenny have shared, the idea all disasters start local and end local. So, one thing I'd encourage you, do an environmental scan of your local resources, what's available closest to you. And I even think of the idea of, we've had 2 IA declarations in the state of Maine in the last 6 months. Pretty unique. We hadn't had one since 2008. And I think the thing to keep in mind is, yeah, we could ask for help for FEMA, but it's not going to be right away. It takes time. So anything you can do to prepare you and your family for those times where you're not going to get resources. And we know in our state particularly, there's parts of the state you can't get there from here. So, because of our rural nature, but also where we are located, a lot of the supplies, and even some of you may remember when they had the baby formula shortage and some of those factors. So it's kind of that same approach. Think about what you can do in case something like that happens. So, reach out to your local community partners that are out there, see what they have available, working close with your public health liaisons. They know what resources are available, your hospitals and medical facilities, particularly pediatrics. They're really good resources in the community because they are really aware of some of the common issues that are being faced.
Yeah, thank you. And so going to your local community, but also your state in terms of training programs, it sounds like. I don't know if you have any other resources regarding that, or if there's anything else you wanted to add, Jenny or Michael.
Yeah, we actually are trying to implement those trainings, and a lot of it is just putting breastfeeding in with the other trainings, because breastfeeding is the normal way to feed a baby, and so we want to just make sure that that's in each of the trainings. I know that Michael has some exercises and some information on it on his website, but we have not been able to get an official, breastfeeding during emergencies training yet. There's some webinars. If you go to the USBC, the United States Breastfeeding Committee website, they have a lot of information on infant and child feeding in emergencies, and that'll give you access to, or they have some links there to several different webinars that, for example, I think Anjali Palmquist has done, and Kathleen Gribble has done. Those are 2 ladies that have been very a big advocate for breastfeeding during emergencies.
Yeah, and I added in the training modules that we have. Again, we're hoping to have these eventually put up on the National Mass Care Strategy website, which is nationalmasscarestrategy.org, but they're not there yet. They're on my consulting firm's website. What this is for organizations who are doing the before, during, and after associated with establishing breastfeeding support, any kind of feeding support really, in shelters. So this is not for the individual to understand better latching or lactation issues or other things. This is for agencies to deal with the logistics and to deal with the staffing and all this sort of stuff from an emergency management perspective.
Excellent. Great, thank you so much. We have about 1 minute left. Does anyone else have any other questions or any other thoughts? Lori, I see that you shared that you worked in pastoral care in a shelter during Hurricane Katrina. I don't know if there's anything you want to share about what you learned then. You're welcome to.
Hello, are you able to hear me?
Yes, we can see you and hear you now.
Okay, good. Yeah, it was just a very, I guess just a very busy, hard, sad, stressful time kind of for everyone. But the people who ran the shelter were very good about making sure all the people who were there were protected, the safety, there was a lot of security around there. They didn't allow children to come in with those who were volunteering, just because it was a hard scene to see. So for kind of their protection as well. But yeah, we just sat with people, we prayed with people, we just listened to them, kind of the stress they were going through. We referred over where we could. But there was a lot in the beginning that was not set in place. And so that's why I'm excited to see like the chart that was presented early about just how each step kind of falls in place with the next. And hopefully it goes that way this time. So it's just exciting to see about the preparation.
Great.
Thank
Thanks
you.
for sharing, Lori.
Mm-hmm.
And thank you everyone for being here today to learn more about this. And hopefully you have a few action steps you can take moving forward, and let us know if you have any other questions after the webinar. We'll be sending out a link to the evaluation. I can actually drop that in the chat really quickly, I think. But otherwise, really quick, like it's so close. There we go. That is the link to the evaluation. If you could share your feedback on it, it's really quick to fill out, and let us know if you need any certificates of attendance. And also, if you want to donate $10 or more, you're entered into that drawing for a $25 Amazon gift card by the end of today. Thank you so much, Jenny and Bill and everyone for being here today. Have a wonderful day.